Soaring high and making difference, where we talk anything about nursing. So let your voice be heard. Right here, Moments with Professor X. Good morning, everybody. It's me again. I'm back. My name is Sander with an X. Hold on. Let me share my screen first, and let me share my page. Posting. Perfect. There you go. Good morning, everybody. How are you? Today's actually Sunday, and it is April 20, 2025. It's 11:48 a.m. my time. So technically, that will be almost 3 o'clock in the morning in the Philippines. So in the Philippines, good morning. How's everybody? How did you celebrate your Holy Week? Me and my family, my cousins, we went to Laughlin, Nevada yesterday, and then we just celebrated there, brought some snacks, food, then we drove back home. So that's it. Later today, around 1 o'clock, maybe 2 o'clock, we will be going somewhere else. So anyway, a big shout out to all my students in Vancouver, Canada. They know that I'm coming this coming 25 to 27. So please let me know if you're in Vancouver, Canada this coming April 25, 26, and 27. I hope to see you there. Anyway, so I think you're able to read the caption and the title for this Facebook Live. So this is a short video clip where we will talk about congestive heart failure. This is so timely because I think there's a lot of cases of, incidents of congestive heart failure nowadays. Not to mention it's a race between diabetes mellitus and congestive heart failure. But if you can still remember, these two are actually related. Most likely a patient with untreated diabetes mellitus will end up having heart issues, vascular issues, and a lot of stuff. So please invest with your health. And be careful with what you eat and your lifestyle. Anyway, before anything else, who do we have here? Let me check. Ooh. Big shout out. Hello to Almera Saga. Thanks for watching. Hello to my friend Gif Paguntala, the CEO and the director of Aim to Top Review Center in Cagayan de Oro City. Thanks for watching, Sir Gift. So anyway, if you're in the Philippines, if you're in Cagayan de Oro City or somewhere in northern Mindanao or Mindanao area, please visit Aim to Top Review Center. They offer quality review programs for various courses. So if you're planning to take qualifying examination for the licensure examination for teachers, reach out to Aim to Top Review Center. To my friend, tell my friend give you discount for the review program. Anyway, so who else? Sabi, Sir John, Sunday nagla-live ka. Wala akong magawa. Sige na lang. So anyway, so we will talk about congestive heart failure. I hope this will be a big help if you're planning to take your qualifying examination and if you encounter questions about congestive heart failure. Okay? So let me share my screen and then let's go from there. By the way, if you have any questions or concerns, feel free to drop a message or send a private message to me and we'll try to answer whatever queries or concerns you have, okay? Or if you want me to discuss any concept, any nursing concept will do. Okay, let me share my screen. Perfect, there. Just wondering, do you have any relatives or friends or family members with congestive heart failure? How are they now? Okay, here it's congestive. Hey, come on. Okay, it's your CHF. Okay, so what is congestive heart failure? Congestive heart failure is a condition wherein there is inability of the heart to pump well. Okay, so again, technically a patient with congestive heart failure, the issue is the pumping mechanism of the heart. There is no issue with the heart rate. Okay, the main concern with heart failure is inability of the heart to pump well. Okay, so inability Now, if you can still remember in your basic anatomy physiology, the main structure, the main function of the heart as a pumping mechanism, as a pumping chamber, as a pumping structure is to squeeze the blood and pump it to the different parts of the body. So come to think of it, if there is a failure of that process, if there's a failure of that mechanism to pump the blood out, then it affects circulation of blood. And if the blood is not well circulated, there is no enough blood that enters to your brain. There's no enough blood that goes to your kidneys, to your liver, to your vital structures. So if there's failure of the blood to circulate, it means to say that it will also affect perfusion of gases. It will affect perfusion of nutrients. Those substances needed for the organs to survive, needed for the cells to normally function what it's supposed to do. Okay, so that is the main concern in your congestive heart failure, inability of the heart to pump well. Now, what causes this condition? Okay, so you may ask yourself, why did the patient end up having this problem, congestive heart failure? So let's identify common causes. Let me remind you that this discussion will not replace whatever management or advice given to you by your family doctor or from your primary care provider. The main purpose of this discussion is to help nurses as they conquer or as they challenge their respective licensure examination. Okay, so this is not only for NCLEX RN or the NCLEX PN. This is also applicable to all my students in the Philippines and outside the US. So if you're in the Philippines, if you're planning to take the NLE, the nursing licensure examination, this is also helpful. For those who are planning to take the qualifying examination in the Middle East, Dubai, you have your DHA Prometric. This is also helpful. Okay, so let's go back. Let's identify what causes this condition. Number one problem that causes congestive heart failure is coronary artery disease. So you say coronary artery disease, there is a problem in the coronary arteries, right? It means to say that the heart of the patient is not receiving adequate blood supply. So if you don't feed the heart with enough blood, it affects myocardial contractility. Okay, take into consideration one example of coronary artery disease called myocardial infarction. What is myocardial infarction? Layman's term, it is what we call heart attack. It means to say that there is coronary occlusion. Now, come to think of it, if this is a coronary artery, okay, and we know for the fact that if it is an artery, it is where your oxygenated blood pass, okay, it passes through there. So if there's occlusion in the coronary artery, blood flow is impossible, okay? So if blood flow is impossible, what will happen to the cells distal to that? They will be deprived of good blood supply. So the tissues distal to the obstruction, okay, will be deprived of good blood supply deprived of good nutrients, and they starts to die. So come to think of it, if that happens in the coronary artery, if that condition happens in the heart, it follows that the cardiac cells will die. Remember, the primary structure the primary structure of the heart is made up of a cardiac muscle tissue. So if you don't supply the blood, if you don't supply the cardiac muscle tissue of adequate blood, the tissues will die. The heart will not contract well because of an injury. So again, because of coronary artery disease, myocardial infarction, the cells in the heart will die. So as a result, once the myocardial cells die or sustain some injury, it will not pump well. Okay. Number two. Second is a patient with hypertension. Okay. And I will correlate that later on in a bit. Let's mix that with a patient with not coronary, but chronic obstructive pulmonary disease, or your COPD. By the way, your COPD is an old name. There's a new name for that, and that is what we call CAL. CAL stands for chronic airway limitation or chronic airflow limitation. Now take note. A patient with hypertension will eventually cause left ventricular hypertrophy or left ventricular enlargement. Whereas a patient with COPD, or chronic airway limitation, one good example here is a patient having bronchitis, will eventually cause right ventricular hypertrophy. By the way, what is hypertrophy? Hypertrophy is a medical term that describes increase in the size of the cell. Okay? Remember, I said increase in the size of the cell. I did not say increase in the number of cells. So technically, when you say hypertrophy, for example, just for the sake of argument, for the sake of discussion, let's say you have 10 cells. Okay? 10 cells. Let's say the size of each cell is 1 mm. That's 1 millimeter. So that's the normal size of the cell and the normal number of cells. In hypertrophy, the number of cells stay the same. There's still 10 cells, but the size is greater than 1 mm. See, that's hypertrophy, increase in the size of the cell. But when you say increase in the number of cells, that's a different thing. An increase in the number of cells, you call that your hyperplasia. Okay, but anyway, either way, hypertrophy, hyperplasia, eventually there will be enlargement. Okay. So now, how come that your hypertension causes left ventricular enlargement, and then your bronchitis causes right ventricular hypertrophy or right ventricular enlargement? Now, let me try to paste picture of the heart here. Hey, come on, what is that? I hope you can see this. Let's lock that one. Okay, remember, this is the anatomy of your heart. Okay, this is the right side of the heart, and this is the left side of the heart, correct? So we know for the fact that the right side of the heart receives and pumps deoxygenated blood, or a blood with poor oxygen. And the left side of the heart receives and pumps oxygenated blood. It means to say a blood rich with oxygen. Okay, so this is your superior vena cava. This is your inferior vena cava or vena cava. This is the right atrium. This is the right ventricle. Okay. This is the left atrium, left ventricle. This is what we call the aorta. Okay, the aortic valve here. This is the pulmonary artery, the pulmonary seminal valve. Okay. Now, remember that the right ventricle pumps blood to the pulmonary area. Okay, to the pulmonary area. Now, why is it important for the right ventricle to pump blood to the pulmonary area? Because the blood on the from the right side is deoxygenated. It needs to go to your lungs for oxygenation. Okay, so that explains why. So it goes to your lungs. Okay, please bear with my drawing. And then from the lungs, it enters to your pulmonary vein. Okay, from the pulmonary vein, it drains the blood to the left side, to the left atrium. Okay. That explains that the left side of the heart receives and pumps a blood rich with oxygen, because the blood that enters the left side of the heart is a blood that freshly came from the pulmonary area, from the lungs. Now, going back to our topic, right ventricular enlargement because of COPD, example is your bronchitis. Okay? Now, if there is an inflammatory process in the pulmonary area, just like your bronchitis, there is inflammation in the bronchial area. Eventually, it causes narrowing of the pulmonary vessels. So it means to say that the blood vessels in the lungs will narrow. Okay, it narrows. So the hole, the opening in the vessel, in the pulmonary vessel narrows. So it affects flow of blood. That explains why when the right ventricle pumps the blood to enter the pulmonary area, the right ventricle will have a hard time. Okay? Because of the narrowing of the pulmonary vessel, there is pulmonary vasoconstriction. As a result, the resistance goes up. Therefore, it increases the workload of the right ventricle. So an increase in the workload of the right ventricle due to pulmonary issue, due to bronchitis, due to COPD. Remember, an increase in the workload of the muscle can eventually cause enlargement. It's a form of compensatory mechanism. It's a form of physiologic response. It's just like saying, just one good example here is if you go to the gym and work out very often, if you work out almost every day, what happens to your muscles? The muscles will grow. Okay, so if you go to the gym on a regular basis, you work out, it increases the demand of your muscles. An increase in the workload of your muscles can cause hypertrophy. That is why gym builders, those gym rat, they have a more prominent, okay, they have a nice tone, muscle tone because of the increase in the demand. Same thing here. Because of an increase in the workload of the right ventricle, it leads to right ventricular hypertrophy or right ventricular enlargement. By the way, an enlargement of the right ventricle to pulmonary problem is what we call cor pulmonale, okay? Or you call that as your cor pulmonale. That is why if you will be asked, what do you think is the best management for cor pulmonale or cor pulmonale? The answer is to treat COPD, okay? And what type of COPD causes right ventricular enlargement? The answer is bronchitis. Okay, let's go back. So how come your bronchitis causes heart failure? Remember, I said that bronchitis increases your pulmonary resistance, okay, causing increased workload in the right ventricle, leading to hypertrophy. Now, when the right ventricle is stretched for a long period of time, okay, just like a rubber band, okay, because of an inflammatory response, because of stretching the rubber band for a long period of time, okay, you stretch it for, I think you know what rubber band is. If you stretch the rubber band, thank you so much, Albert Ojena. If you stretch the rubber band for a long period of time, let's say you stretch it for a month, and you release that, do you think the rubber band will go back to its normal appearance? No, because you stretch it for quite a while. Same thing. If the heart is inflamed, stretched for a long period of time, it loses its elasticity. It loses its normal pumping ability. So that will result to heart failure. Okay? Inability of the heart to pump well because of the condition of what? Cor pulmonale or cor pulmonale. Okay? So don't forget this. If you will be asked in your NCLEX, what COPD causes right-sided heart failure, or what COPD causes enlargement of the right ventricle, the answer is bronchitis. Okay? Now, what about hypertension? Hypertension can cause left ventricular hypertrophy. Why? Remember that the left ventricle needs to pump blood to the systemic area. Remember, this is the aortic similar valve, and this is the arc of aorta. Now, if your patient has hypertension, by the way, what is hypertension? Hypertension refers to persistent elevation in the blood pressure. Usually, if the blood pressure is greater than 140/90 millimeters mercury. But I think they have a new definition of hypertension now. Okay, I'll check on that later. But nevertheless, because of persistent elevation in the blood pressure. Oh. Hello to Ahmad Nabhan. Thank you, sir, watching from Kingdom of Saudi Arabia. I'm your student way back 2010. St. Louis Review Center, Zamboanga. I will be taking my NCLEX this May. Oh, congratulations in advance, Ahmad. Thanks for watching. How's everybody there in Kingdom of Saudi Arabia? Oh my God, I miss Zamboanga City. What is a famous line I used to say there? No buta basura aki. It means to say, bawal magtapon ng basura dito, or no throwing of liters here or garbage here. Anyway, so because of persistent elevation in the blood pressure, because of untreated hypertension, that increases the patient's systemic vascular resistance. Okay? So because of hypertension, it increases vascular resistance. Same thing that happens to patient with bronchitis. Okay, so when the pressure is so high in the systemic area, the left ventricle now will increase its workload. Okay, just to overcome the pressure. Okay, just to overcome the nagduwit pa tayo no. So really, so what song did we sing back then? Ahmad, please remind me, okay? So that will eventually cause left ventricular hypertrophy or left ventricular enlargement. Okay? Now that is very clear. Sir Sander or Sir John, you've been telling vascular resistance. You call that resistance in your anatomy physiology as your afterload. Okay? Can you still remember afterload? Okay? An afterload is the resistance that the heart needs to overcome in order to pump the blood out. So if you go back, if you try to remember the explanation I made a while ago, that the right ventricle will pump the blood to the pulmonary area. Therefore, the afterload of the right ventricle depends on the pulmonary vascular resistance. Now, you call that as your mean pulmonary arterial pressure. The higher the pressure in the pulmonary artery means increased afterload for the right ventricle, causing increased workload leading to hypertrophy. So tell me, what is the normal mean pulmonary artery pressure? It is usually less than 20 millimeters mercury. Okay, it is usually less than 20 millimeters mercury. Now, what about for the left ventricle? The left ventricle afterload depends on the vascular resistance in the systemic area. Remember, there's such thing as systolic pressure and the diastolic pressure. Pay attention to your diastolic. So the normal vascular resistance that the left ventricle should overcome must be less than 80 millimeters mercury. That is why if your patient is hypertensive, let's say the blood pressure of your patient is 200 over 100 millimeters mercury, the diastolic is 100. And the normal is less than 80 millimeters mercury. Therefore, if it's greater than 80, that increases the workload of the left ventricle. That is why nurses, okay, even if you're not you're not a nurse, or you don't belong to the medical field, if you have a family member who is hypertensive, okay, who is a smoker, tell them to quit smoking. Tell them, for those hypertensive, tell them to regularly take their antihypertensive medicine. Okay? Quitting smoking decreases the risk of stroke. Quitting smoking decreases the risk of cardiovascular problem. Taking your antihypertensive medication prolongs your life of about 10 years. Okay? That's based on studies. So take your antihypertensive medicine. Okay? That is a simple health teaching instruction, and that will save your patient's life. Hello to by the way, sir, request po ako neurovascular system. Okay, sure. So I might discuss neurovascular issue most likely next week, okay? So when you say neurovascular, we can talk about stroke. Okay, we can talk about stroke. What else? Yeah, mostly stroke, right? So for neurovascular. So anyway, what else? Number four, another cause of congestive heart failure is a condition called cardiomyopathy. What is cardiomyopathy? Cardio is heart. Myo means muscle. Pathy means there's an injury or damage in the cardiac muscle tissue. Okay? So it's self-explanatory that if there's an injury in the cardiac muscle, it affects pumping mechanism. Okay? So there are several causes. Obesity. What else? Infection. Okay, there are several causes of congestive heart failure, but these are major four factors that can lead to development of inability of the heart to pump well. Now, in your NCLEX exam, sometimes you'll be asked about signs and symptoms, and then the question will be select all that apply. Okay? Now, please do not forget that in your select all that apply, you need to remember, hey, what is this? It's okay. So there are two common types of heart failure. Okay, there are two common types. So we have here your right-sided congestive heart failure. And number two is your left-sided congestive heart failure. Good thing we have picture below. So right-sided heart failure will technically give you what? More on systemic or more on pulmonary manifestations? Now, let's try to dissect this one. Right-sided congestive heart failure. So right-sided, remember that this is the right side and this is the left side. The right side of the heart receives blood from the systemic area. So it means to say that the right side of the heart is not pumping well. Now, look, if the right side of the heart will not pump effectively, the blood cannot get out. The blood cannot get inside the lungs of your patient. So the blood will congest on the right side, filling the right side of the heart. That is why we call it congestive heart failure. There is congestion. So as a result, if the heart will not pump on the right side, blood from the systemic area cannot get inside the heart, causing systemic congestion. Okay? So right-sided will give you more on systemic congestion, leading to, of course, systemic manifestation. Left-sided heart failure means that the left side of the heart is not pumping well. So if there's failure on the right side to pump the blood out, the blood from the lungs of the patient cannot get inside the cannot get inside the left side of the heart. Because of failure of the heart to pump well, it causes backflow, okay, causing pulmonary congestion. Because again, left side of the heart failed to pump well, blood congests on the left side, so blood from the lungs cannot get inside the left side, filling the lungs of the patient, giving you pulmonary congestion. Okay? Now, if we're going to discuss this in detailed, session, there's such thing as backward failure and forward failure. Okay, but for your NCLEX, please pay attention that the right side will give you more systemic manifestation and the left side will give you more pulmonary manifestation. So let's identify. Okay. So for the right-sided congestive heart failure, I said it's systemic congestion, so there will be edema. Okay. Number 2, there will be weight gain. Now, in your NCLEX, it's not enough to say weight gain. There should be a parameter. When can you say that the weight gain of your patient is attributed to fluid volume excess? The answer is if the patient gained weight of more than 1 kilogram or more than 2.2 pounds per day. Okay, so again, fluid volume excess, weight gain of fluid volume excess is a weight gain that the patient accumulated or gained more than 1 kilogram or more than 2.2 pounds per day. Okay. Next, number 3, because of systemic congestion, there will be hypertension. Number 4, there is distended jugular vein. So the jugular vein of the patient is engorged or distended. Okay. Number 5, remember, because of systemic congestion, if you try to feel the pulse of your patient, there will be strong and bounding pulse. Why do we have strong and bounding pulse? It's because of systemic congestion. Number 6, there will be ascites. Number 7, because of systemic congestion, the liver increases its size. That sometimes will include the spleen of your patient, giving you hepatosplenomegaly. So there's enlargement of the liver and spleen. Now, do not forget this in your NCLEX. Since it affects the liver of your patient, this is the type of heart failure, okay? This is the type of heart failure that affects the liver. And since it affects the liver, it will most likely lead to liver cirrhosis. Remember, not all liver cirrhosis is attributed to alcoholism, okay? If you can still remember in your medical surgical nursing, we have several types of liver cirrhosis, right? Can you still remember the different types of liver cirrhosis? Can you still remember the different types of your liver cirrhosis? Where is that? Oh, no. Here. Can you still remember the different types of liver cirrhosis? Hey, where is that? Can you still remember the different types of liver cirrhosis? Okay, first, a liver cirrhosis attributed to alcoholism is what we call Leydig cirrhosis. Okay, Leydig cirrhosis. Number 2, a type of liver cirrhosis attributed to liver infection, just like your hepatitis, is what we call post-necrotic cirrhosis. a type of liver cirrhosis attributed to obstruction in the normal outflow of bile, just like the patient with cholelithiasis. That type of liver cirrhosis is what we call biliary cirrhosis. And the type of liver cirrhosis related to congestive heart failure is cardiac cirrhosis. So those are the 4 common types of liver cirrhosis: Leydig cirrhosis, biliary cirrhosis, post-necrotic cirrhosis, and cardiac cirrhosis. So please do not forget this. If you'll be asked in your NCLEX, a type of heart failure that causes liver cirrhosis is the right-sided. Okay? Now let's proceed. Okay, what else? So take note that is for your right-sided. Now what about for left-sided heart failure? For your left-sided heart failure, left-sided congestive heart failure, of course, number 1, patient will have cough. Okay? Remember that cough is a cardinal sign of patient with pulmonary issue or pulmonary problem. Okay, have you noticed that all patients with pulmonary issue, lung issue, they always have cough? Okay, cough. By the way, you have a comment here. Ahmad Naban said, "Sir, this live will be uploaded in your YouTube account or here in FB account." So actually, I stream on different platforms. So this is actually uploaded in my Instagram, my Facebook account, and my YouTube. Okay, and then another Facebook page for my students from Las Vegas College. Okay, so cough, number 1. Number 2, patient with left-sided heart failure will have dyspnea. So there's difficulty in what? Breathing. So take note if your patient is dyspneic. Okay, dyspneic, there are different types of dyspnea that you need to understand. So there's such thing as what we call orthopnea. Orthopnea is a type of dyspnea attributed to what? Positioning. There is another type of dyspnea related to physical exertion. So if the patient has an increased physical activity, that's the only time patient will have difficulty of breathing. You call that type of dyspnea as your exertional dyspnea. Then we have another type of dyspnea that usually occurs at nighttime. Okay, why nighttime? Because during daytime you were very active, and during daytime the blood, the fluid goes to your lower extremities. And then when nighttime comes and then you sleep, the fluid that accumulated from the lower area will go to your lungs, because that's the lowest part now when you sleep, when you lay in your bed, and you will have troubled breathing. You call that type of dyspnea as your paroxysmal nocturnal dyspnea. Okay, so those are the 3 common types of dyspnea you need to understand. You have your exertional dyspnea, you have orthopnea, and then you have your paroxysmal nocturnal dyspnea. That is why it's a red flag if you have a patient who tells you, "I cannot sleep at night with only 1 pillow. I need to have several pillows behind my head, as if I am sitting because I feel like I'm drowning and I cannot sleep. I have trouble breathing if I lay flat." Okay, so that's one thing. Okay, patient is dyspneic. Number 3, because of pulmonary congestion, you will have hypoxia. Hypoxia refers to decreased oxygen to the cells. Okay, this is different from your hypoxemia. Hypoxemia means decreased oxygen in the blood. But the question there, will hypoxemia cause hypoxia? Yes. Okay, hypoxemia can cause hypoxia, but it doesn't follow that if you have hypoxia, you 100% have hypoxemia. You know what I mean? Okay, I hope that makes sense. So again, if you have hypoxemia, it can cause hypoxia, but it doesn't mean to say that if you have hypoxia, you have hypoxemia, because you can have hypoxia in the event that there's obstruction in the coronary artery. See, it's not hypoxemia that is obstruction related. Anyway, so because of hypoxia, decreased oxygen to your cells, it may trigger compensation. And then one effect in the heart is that it increases the heart rate of your patient. So take note, there is tachycardia. The other side, strong bounding pulse. This one, increase in the heart rate. Take note, there's a big difference between increase in the heart rate and strong bounding pulse. Okay, next, number 4, a patient with left-sided congestive heart failure may have hemoptysis. Okay, so patient may have hemoptysis. What is hemoptysis? Hemoptysis is spitting out of blood. Now take note, not all patients with hemoptysis is always related to tuberculosis. Okay, so please, not all patients with hemoptysis is attributed or related to pulmonary tuberculosis. You can spit blood even without active TB infection or TB infection. Number 5, because of hemoptysis and pulmonary congestion, patient may have pink and patient may have frothy sputum. Number 6, patient with left-sided heart failure will also have abnormal breath sounds. Okay, so when I say abnormal breath sounds, these are your adventitious breath sounds. Okay, these are different from your normal breath sounds. So what are your normal breath sounds? So you have your bronchial breath sounds, vesicular breath sounds, bronchovesicular breath sounds. Those are normal breath sounds. When I say abnormal breath sounds, I am referring to your crackles, rowels, wheezes, stridor. Those are your abnormal. By the way, stridor, wheezing sounds are related to airway obstruction. Usually it's a form of a partial airway obstruction. But if the airway obstruction is complete airway obstruction, what you will have is sudden aphonia. What is sudden aphonia? What is aphonia? Loss of voice. So sudden loss of voice is an indication of a complete airway obstruction. That is why sometimes in your NCLEX exam, you'll be given a scenario like a patient in room A is having asthma and you can clearly hear expiratory wheezes, which is a form of a noisy breathing, and that is a presentation of partial airway obstruction. And then moments after that, like 30 minutes after that, there's moment of silence. Why? Because there is already complete airway obstruction. So you need to go to your patient, assess your patient, and call a code or call a rapid response, okay, depending on the condition. Okay, so that's it. So complete airway obstruction is sudden aphonia. Partial airway obstruction is noisy breathing. But for crackles, rows, okay, crackles, these are actually attributed to congestion, pulmonary congestion. Okay, so anyway, those are what we call the abnormal breath sounds. Okay, so again, so you should draw the line between right-sided and left-sided in your NCLEX. You should know which one has a pulmonary manifestation and which one has a systemic manifestations. Okay, I hope this one is clear. Now, a patient with congestive heart failure, what are common diagnostic tests done here? Hey, how can I remove this picture? Hey. Okay, let's do that. Okay, what are common diagnostic tests? What are common tests here? What are common diagnostic tests that will support congestive heart failure? Number 1, you have your chest X-ray. Your chest X-ray. By the way, your chest X-ray uses radiation. That is why part of your nursing responsibility, especially if a patient is a female patient in the reproductive stage or reproductive age, make sure that your patient is not pregnant. Okay, because of radiation exposure. One important question here is, when was your last menstrual period, or are you pregnant? Okay, that is why there's a need for us to do pregnancy test if your patient needs a series of X-ray. Okay, so what will be the result in your X-ray if there is congestive heart failure? X-ray reveals enlargement of the heart. Okay, there's enlargement of the heart. What else? You have your EKG, your electrocardiography. I know that your EKG records electrical activities in the heart, but your EKG will also somehow give you an overall picture of the heart, especially if it's a 12-lead EKG. You will have an idea which chamber, okay, has an enlargement, whether it's the right side, left side, right ventricle, left ventricle. So an EKG may show enlargement of the ventricle. Okay. Next, another is your 2-dimensional echocardiography, your 2D echo. Okay, your 2-dimensional echocardiography is so helpful because not only looking at the thickness of the cardiac muscle tissue, your echocardiography will also evaluate your ejection fraction, your EF. What is the normal ejection fraction? The normal ejection fraction is equal to or greater than 55%. Remember that the higher the ejection fraction, the better. By the way, what is ejection fraction? Ejection fraction is the percentage of blood ejected. Okay? Now, The lower the ejection fraction means more blood stays inside the heart. Okay, now let me give you an example. This is just for the sake of argument. Okay, let's say if your heart has 100 ml of blood in it. Okay, let's say that your heart has 100 ml of blood. When the heart pumps the blood out, okay, when the heart pumps the blood out, it will only squeeze, okay, it will only squeeze greater than 55%. Okay, so let's say you still have, let's say, 50% of blood left. Okay, so the higher the ejection fraction, the less blood stays inside the heart. The less blood stays inside the heart, then the lesser chance that you will end up having congestion. Make sense? So make sure that the ejection fraction is greater than 55%. But take note, not all patients with heart failure will have issue with ejection fraction, because there is such a thing as heart failure with preserved ejection fraction. You call that your diastolic failure. There is such thing as heart failure with reduced ejection fraction. You call that your systolic failure. Okay, next. Anyway, number 4. Another diagnostic test will be some blood tests, just like your BNP. Okay, what is BNP or your B-type natriuretic peptide? Okay, is it different from a pro-BNP? Yes, they're different. Okay, but are they related? Yes, they are related. Your BNP is a form of a protein. Your pro-BNP is a protein too. They're both proteins. Your BNP is a protein, which is an active form of hormone. Okay, but it has a lower half-life. That is why the BNP level in the body is lower compared to your pro-BNP. Your pro-BNP is also a protein, but a form of biologically not active hormone, which is a fragment of BNP synthesis. Okay, so as a result, the pro-BNP has a higher level in the circulation because the half-life is longer, and the pro-BNP makes it more sensitive if you want to check issues like heart failure. Okay, now the BNP, the normal values, the BNP is usually less than 100 picogram per ml. Okay, if the BNP is greater than 100 picogram, that could suggest heart failure. For pro-BNP, it is usually less than 125, okay, picogram per ml, especially if the age of the patient is younger than 75. But if it's older than 75, it's usually greater than, let's say, greater than 450 picogram per ml. Okay, so these are common tests you need to understand. Now, a patient with congestive heart failure, what do you think is the goal in treating patient with heart failure? The goal in treating patient with heart failure is to increase the force of contraction. Okay, without increasing the heart rate. Remember, I said on the first part, early part of this clip, of this video, I said that a patient with heart failure, there is no problem with the heart rate. The main issue is the contraction, the contractility of the heart. So the goal is to increase the force of contraction without increasing the heart rate. Okay, so how do you achieve that goal? Okay, by using these different approaches. So what are the different approaches you do to treat patient with heart failure? So you have here unload fast. What's upload? Unload fast. Hey. Okay, so we have here unload fast. Okay, unload fast. U stands for your upright position. Why do you have to position the patient upright? In short, you need to elevate the head of the bed. Okay, for what reason? We need to position the patient upright to prevent pulmonary congestion. Not only that, if you position the patient upright, it promotes good lung expansion. Okay, N stands for nitrates. One good example is your nitroglycerin. Remember, the effect of your nitrate is that it causes vasodilation. Okay, so when the blood vessels dilate, it improves circulation and it decreases vascular resistance. Okay, L stands for your Lasix. This is a form of a diuretic. It is a potassium wasting diuretic. That's your furosemide. Okay, remember, Lasix, diuretic in general, is best given in the morning. We refrain giving diuretics at night because if you give diuretic at night, the patient cannot sleep. It causes nocturia. So patient will be awake all night because he needs to go to the bathroom, okay, or to the restroom. O stands for oxygen. Okay, why do you have to give oxygen? Because patient is having trouble breathing. A stands for aminophylline. Aminophylline is a bronchodilator. Okay, aminophylline, theophylline. This is a form of xanthine derivative. Just a good reminder, normal aminophylline, theophylline is 10 to 20. More than that causes aminophylline, theophylline toxicity. So watch out on that. Okay, by the way, I'm planning to do a review about pharmacology most probably next week. D stands for the drug of choice. Okay, what is the drug of choice for congestive heart failure? The drug of choice is digitalis. Okay, what is another name for digitalis? Okay, another name for digitalis is what? Anybody? And by the way, D for the specific drug given to your patient. Digoxin or lanoxin. We will talk about that in a bit. Same with your digitalis. F stands for your fluid restriction. Why do you need to restrict patient with fluid? Remember, there's congestion, fluid restriction. A stands for afterload decrease. Why do you need to decrease the afterload? Remember, I said the higher the afterload, the more it increases workload of the heart. So how will you decrease the afterload? You decrease the afterload by promoting rest, okay? Giving diuretics. We can give ACE inhibitors. We can give vasodilators. Speaking of ACE inhibitors, just like your captopril, don't forget that one common side effect of captopril is dry cough. And if you stop taking captopril, the dry cough disappears. Okay, another thing. If your patient takes captopril as an ACE inhibitor, you need to watch out for hyperkalemia or an increase in the blood potassium level. Okay, next, S for your what? Sodium restriction. Why we have to restrict sodium in the diet? Because sodium attracts water. The more water retains in the body, then the more it causes congestion. And T for what? Test. Okay, what specific test you need to identify here? Test for your ABG because of issues with your breathing issue. It may also affect acid base because of breathing issue. Test for your potassium because remember, you're taking Lasix. Okay, you may also take ACE inhibitor, and most importantly, test potassium because your patient will most likely take a drug called digoxin. Remember, a decrease in your potassium increases the risk of digitalis toxicity. Why? Because hypokalemia potentiates the effect of digoxin. It means to say, when the blood potassium level drops in the normal level, then it increases your likelihood to develop digitalis toxicity. Okay? What else? Test for your digoxin level. Or your digitalis level. Okay? So these are the approaches you need to remember. Okay? Usually in my actual review, I discuss this one by one in detail. But here, let's talk about digoxin. Okay? Okay, digoxin. This is your digitalis. Okay? Your digitalis or your digoxin. Okay, one good example here is your digoxin or digoxin, which is a form of By the way, I asked the question a while ago. What is another name for digitalis? You call this as your cardiac glycoside. Okay? Your digoxin, or you call this as your lanoxin. Okay? You'll be asked in your examination, what are effects? Okay? What are effects of your digoxin? Your digoxin has two primary effects. What are the two primary effects of your digoxin? It has a positive inotropic effect, and it has a negative chronotropic effect. Chronotropic effect. So when you say positive inotropic, what do you mean by this? As a positive inotropic medicine, this is an agent that increases the force of contraction. As a negative chronotropic agent, it decreases what? It decreases the heart rate, and it also decreases your blood pressure. Now take note, if you go back to the goal, if you were listening attentively, remember I asked a while ago, what is the treatment goal for patient with heart failure? I said that the treatment goal is to increase the force of contraction without increasing the heart rate. That's the goal. And guess what? This is the action of your digoxin. These are effects of digoxin. That is why if digoxin, the effects are to increase the force of contraction without increasing the heart rate, that makes digoxin as the drug of choice. Because the goal in treating heart failure is or are the effects of your digoxin. Okay? Now, things to remember in your NCLEX exam. Remember, I said in your unload fast, last letter T test for what? Digoxin level. Now, what is the normal digoxin level? The normal digoxin level is 0.5 to 2.0. Okay? 0.5 to 2.0. If it is greater than 2.0, that indicates digitalis toxicity. Okay? Digitalis toxicity. So select all that apply. What are signs and symptoms of digitalis toxicity? If you can still remember your Van Dab. Okay? These are the different signs and symptoms of digitalis toxicity. V stands for visual disturbances. So when you say visual disturbances, patient may have halos, yellow halos around the light. A, patient may have what? Patient may develop abdominal pain or abdominal cramps. Okay, N stands for nausea, vomiting. Okay, Van Dab. D, patients may have diarrhea. A stands for anorexia. B stands for blood pressure that is low. And B stands for bradycardia. Remember, it may decrease the heart rate of your patient. That is why, take note, a patient with digitalis toxicity, what is the antidote? What medicine will you give the moment patient develops toxicity towards digoxin? The antidote is your digoxin immune fab. One good example here is your Digifab or Digibind. Okay? I hope that one is clear. Now, highlight in your examination. If your patient is receiving digoxin, okay, put an asterisk there. You write nursing alert. Thing to remember as a nurse. If your patient takes digoxin, okay, do not give digoxin if the heart rate of an adult patient, okay, is less than 60 beats per minute. Do not give digoxin if the heart rate of a child, pediatric, okay, is less than 100 beats per minute. Do not give digoxin if the blood pressure is less than 90/60 millimeters mercury. Because again, it causes bradycardia, it causes drop in the patient's blood pressure. Okay? And what else? Number 2, if your patient takes digoxin, okay, take note, you need to watch out for what? Hypokalemia. That is why you need to check for decreased potassium level, because I said a decrease in the potassium increases the risks of toxicity. Oh my God, you can't see that. But it's the digitalis. It's digitalis. My image is covering the... Hold on, let me check that. Change it like this. There. Okay? Digitalis toxicity. Okay, why? Because again, when potassium in the body decreases, it potentiates the effect of digoxin. Okay? Okay, I hope you learned something, guys. So those are things you need to remember about congestive heart failure. I hope you learned something, okay? Anyway, I think that's all. If you have any questions, please let me know. Drop a message if you have any concerns or anything in general. God bless everybody. Keep safe. And I hope to see you soon, okay? God bless everybody. Bye.